So the risk factors for this rupture of membranes are maternal factors, uteroplacental factors and fetal factors. So in the maternal side, if there is a history of previous PPROM, the recurrent risk is 16 to 32% when compared to the term rupture of membrane. Then antepartum bleeding, anything happened in the antepartum period, or they are using chronic steroids, or they may be having some collagen vascular disease. Sometimes there may be a direct abdominal trauma, cigarette smoking, illicit drugs, history of anemia. So this is one of the most common cause for this PPROM. And underweight less than BMI less than 19.8 kg per meter squared, low socioeconomic status. All these are contributing to the PPROM from the maternal side. What is from the uteroplacental side? So first is uterine anomalies. Next, it can be a placental abruption, that is contributes 10 to 15% of PPROM. Sometimes there may be advanced cervical dilatation, prior cervical conization, short cervix in the scan less than 2.5 centimeter, uterine overdistension like multiple pregnancy, polyhydramnios, anything that is overdistended uterus that can cause PPROM. Sometimes intraamniotic infections can cause PPROM, and the repeated PVs, multiple PVs can cause PPROM. From fetal side, yes, if there are multiple pregnancy, they will cause PPROM in 7 to 10% of the twins. So that is one of the risk factor for your PPROM. So these are the indications, as I said before. So intrauterine infections, STDs, prior PPROM, smoking, multiple gestations. These are all the risk factors for your PPROM. So what are the pathogenesis for this leaking? So for term leaking, we say them it is programmed cell death and activation of the catabolic enzymes such as collagenases that will naturally weaken the membranes, and it will from the force of contractions they may rupture. So before onset of true labor pains, they may have rupture of membranes. For preterm PROM, what is the reason? It is most of the time it is due to underlying pathological process, due to some inflammation or infection of the membranes. Anything could be.